essere rimasti così.
First of all, I wish to thank you all for staying so numerous here despite the hot environment. So, and I apologize for that. This is a 34 years old girl who has been diagnosed a congenital aniridia variant. Actually, the iris is there. And she has an ocular hypertension that has been controlled by means of preservative-free timolol. At present, she has a nystagmus. And we haven't performed an OCT, but probably she has hyperplasia of the cornea, a good general health, no familiarity. And I saw her for the first time last week as a consultant because she complained about recurring ulcers. We're finished with the patient. Dr. Maurino says, am I live? Yes. So we are done in the operating room, as you probably have seen on the screen. So Vincenzo has brilliantly finished his surgery. Okay, thank you. You know, it's always difficult to perform surgeries out of home, but the whole team has been absolutely great. And this wasn't a very easy surgery because, you know, there was a combination of Fuchs and keratoconus, and it was quite deep. So the cornea actually went down, but the chamber didn't get any flatter. And so the punch was clockwise, and the F couldn't be seen. And but although the bubbles are not really joined and united, I think this is the advantage of a peripheral marking. So pressure was 25, 26, and I'm sure that the bubbles or the bubble will go away. And so I'm very happy, and so I thank you.
Beautiful, beautiful surgery. Can you please continue?
Sure. Quindi lei viene.
So she was referred to me for these recurrences in the left eye. Okay, the images are out of focus because the lady, of course, she has a nystagmus, so it was difficult to take a picture. And you already know it, but let me repeat it, that aniridia is a panocular pathology. So not only is there a deficiency of the iris or abnormality of the iris, which is the most, or the prevailing phenotypic aspect, but also hyperplasia of the cornea, dislocated cataract often, and all of them develop a limbal deficiency. So if we color by means of fluorescein, we see that there is an initial limbal deficit in the right eye, and late staining totally in the left eye, apparently. So what can we do for for this patient? She was told not to do anything, but she has these recurring ulcers. She doesn't feel well, and so we have several experts here. Now I'm going to make the patient come here so we can examine her and visit her, and then we may comment.
Yes. So Enrica's going to examine